So big heart news over the weekend. The American Heart Association's annual scientific sessions in Philadelphia, Pennsylvania discussed a large and monumental heart study called Ischemia. Ischemia was a study that took over 5,000 people with what we call stable angina. Stable angina is different from those people having heart attacks or sudden onset of chest discomfort or breathing problems. But these are things that happen more routinely or predictably. And they subjected them to stress tests, of which a lot of people end up getting stress tests. Stress tests in most people's eyes are pass-fail, but in this study they didn't make it pass-fail. They sort of said you had to have a higher risk stress test. And if you had a high risk stress test, what they ended up doing eventually was to randomize you or flip a coin. And if that came up heads, then you underwent what you would have gotten before this study came out, which would have been a heart catheterization. And that heart catheterization could have led to you getting stents or bypass surgery to open up a blockage in your artery. If it came up tails, then you got randomized to the arm where your doctor would have pushed medicines for you, like aspirins and cholesterol-lowering medicines and other anti-anginal medications. And they followed people for 4 years to see how they did between the two different groups. And so this really was a study to sort of see, do we have to early catheterize patients with stable angina and higher risk stress tests? And the results are in some ways very confusing, but in some ways very informative. What it really means is that the stress test is not the be-all, end-all. A heart catheterization leading to a stent or bypass surgery is also not the be-all, end-all. But these are all tools to try to help figure out what is the right strategy. When we randomized patients and we upped their medical therapy, patients did very well. When they got stented and they got stented successfully, they did very well. And when they got bypass surgery, they did very well. And over the 4 years, there was only a slight difference between the two groups, really meaning that this is an opportunity from a standpoint of patients and the doctors to get together and start talking about using these tools and individualizing decision making for taking best care of your heart. And the beautiful thing is we have a lot of tools in terms of medicines, cholesterol lowering, lifestyle changes, as well as refined techniques for stents and bypass surgery to be those tools that can make a big difference for patients.